uh, to make it simple, body and brain are well connected through spinal cord. So chiropractic mainly works on your nervous system. Through what this chiropractic does is, when they adjust the spine properly, the muscles which are not active these days because of lack of exercise and sedentary lifestyle, so they won't get this proper signal from the brain
Hmm.
because of the inactive state. So what chiropractic does is, when they do these spinal adjustments, it gives a gush of signals from the brain to those muscles to get activated. And finally, when the muscles are getting back their signal as they get activated, now it is the part of the physiotherapy or for part of the exercise to know the muscles are moving right now, and they should now strengthen them or stretch them to get that fitness back again, so that they will be having less symptoms, and that's how it works.
Okay, so it sounds like I should first visit a chiropractic and then go into
Yes,
physiotherapy
they
and
would
whatever else.
properly examine you and assess your spine and see which muscles are very stiff, which muscles are tight, and they adjust you accordingly.
Okay, that's quite interesting. So, this is a program for runners. So,
Yes.
let's say I'm a runner. I have tight, calf muscles. So,
Yes.
should I come to you, and would you know specifically how to activate my calves? I mean, what I'm hearing is you know exactly where to
Yes.
press the spine,
Yes.
if I may say so.
We
Yeah.
would we would properly examine your muscles from top to bottom and tell you which muscles are tight and which muscles are weak. So, a tight muscles require a flexibility training, that is stretches. A weak muscles requires a strength training, so to get them back. So that's how we examine every muscles and give a chiropractor idea of what idea of our examination, and they'll adjust you accordingly. So that's how exercise demarcation in fact is, because most of the people are not aware of proper exercise training,
Mhm.
what type of exercise they have to go through, either it is flexibility or strength or endurance. So this demarcation we give to the patients according to our examination of their body.
Nice. So it sounds like this is something that can benefit everybody. It's not just for athletes. Is that correct?
Yes, yes,
Yeah.
it definitely does, because it's always the tailor made.
Okay. So for every patient, you essentially are able
Yes,
to examine
yes,
the patient, touch and feel, and then figure out exactly what to do with that
exactly.
patient.
Everyone is unique.
Mhm.
So that's how
Okay.
it. Yeah.
Yeah. And how about age? I mean, as you age, is it more beneficial? Does it matter? Does age have anything to do with this?
Age definitely does plays a primary role in this, because as we age, obviously the level of activity reduces
Mhm.
in our body, and the lack of motivation too. So again, the lack of motivation, less exercise again will inactivate those muscles which are essential for the daily living, or depending on their activities or sportive activities. So again, the same thing, it comes to the root cause again. Examine them clearly, counsel them. Counseling plays a very vital role in physiotherapy, to make the patient understand that this is the reason for your pain, and you have to go through these exercises to make you better. It's very specific and very pinpointed.
Okay, so I'm going to get in a little bit deeper into this because I hear you mention the word patient many times. So
Yes.
if I'm not a patient, should I not be visiting you?
So this is what I wanted to say clearly, because most of the patients visit a physiotherapist only when in physical pain, actually.
Ah,
But if a person is a beginner of exercise, or just doing the random exercise from watching YouTube or online, they should have clear idea of what exercise they have to go through for their body. In fact, I tell my tell my clients that every person, every human born in this world have a seven basic or fundamental factors in them.
Mhm.
So that is flexibility, strength, stamina, balance, control, coordination, and proprioception.
Mhm.
Any issues with the body, either it is a disc issue or spine issue or a calf issue or anything, muscle, bone. So any the problem arises either of this in this one of the fundamental factors. If the muscle is tight, then you have to go through flexibility. If a person is obese, then you have to go through a combination of factors. Because the person is obese, he is not exercising, so his muscles would be tight. So you have to go through stretches, flexibility, strength, and endurance exercises to get for the weight loss. So again, so every person before exercising, he need to consult a physiotherapist to properly know the idea of what exercises you have to go through for the level of fitness is achieving.
Mhm.
Hmm. So unfortunately, this concept of consulting a physiotherapist, even a normal person, people are not aware of.
Sure. So they only, when something is broken, they say, "Oh, I need to take care of this now."
Yes, yes.
Okay. Um, you sound completely sold on this. Tell us something about, your journey. How did you choose this as a career amongst all the options? How did you come into this?
So basically, again, I didn't got the MBBS one.
Yeah.
So I chose physiotherapy. Then, after choosing one in the second year of my graduation, then I finally started to dig up what exactly is physiotherapy. And then I started to go through deep into it.
Mhm.
But after years of my practice, I just analyzed what is going wrong with this paper, with the people.
Mhm.
So why people have high cholesterol issues, or why people have sprain issues, or strain issues, or disc issues. So after analyzing everything, I came to a conclusion that either it is because of the lack of fitness. I mean, again, sedentary lifestyle. For me, disc issues is an end stage problem.
Mhm.
So why he no or even runners also, why they ended up in sprain or strain? So because of the lack of fitness, because they're if they're exercising, they're not doing the right exercise. If they're doing the right exercise, they're not giving a proper dosage or the
Mhm.
repetitions, number of repetitions to that particular muscle. And if they are giving the right exercise and proper dosage, but the frequency is wrong, or the intensity frequency is wrong, I mean, they're not
Mhm.
doing the same exercise for number of times per week. So all this matters. It's called a fit principle: frequency, intensity, time, and type of exercise.
Mhm.
So everything matters. If they're not doing those particular exercise in the right mode, then those muscles doesn't have enough strength to sustain the mechanical forces that a body has to take in their daily life,
Mhm.
and it ends up in a disc issue. So as the muscles are, we believe the muscles are the protective wall of the body. If they become weak enough, the internal structures get weaker, like the bones and joints, and finally it's up in a disc issue. Or if they're not properly loading the muscle, then it turns into a strain. So all this, through my years of practice and research, I came to this conclusion. So
Okay. Nice. So, there is, you know, I think the world is divided into two halves. There are runners and there are
yes,
non-runners, right?
yes,
So,
yes,
non-runners somehow believe that running is bad for you and it's just a matter of time. Over a few years, it all catches up and your body starts to break down. So,
yes.
what is your take on this? Is running, preferred to, let's say, cycling or other exercises, or is it just that people are not investing enough to get their body prepared for running, and that's why they break down?
So basically, one thing is they're not prepared for it, or they're not. If they're prepared, they're not sufficiently prepared for it.
Uh-huh.
Yeah. So for a person to be a runner, basically his lower part of the body have to be very strong and
Mm-hmm.
endurance have to be a more important. So considering the lower body, the quadriceps, which is the front side of the thigh muscle, and the hamstrings, which is the back side of the thigh, the calf,
Mm-hmm.
every muscle, the glutes, no side glutes, every muscle have to be strong and endurant.
Mm-hmm.
So if they're not training these muscles properly, then no, they cannot sustain for longer time. And most of the runners, they strengthen their calf, they focus on the endurance of the calf muscles,
Mm-hmm.
but the front side of the lower part of the leg, the tibialis anterior muscles, and the no muscles, these are the muscles which uh, dorsiflex, I mean lift your ankle up,
Mm-hmm.
and they twist your ankle to the sides. Eversion and inversion, we call it as.
Yeah.
So this is a muscle which is highly ignored
Okay.
usually. Only calf is strong, the back side of the muscle, so the front side of the muscle is ignored. So it creates that imbalance or in the mechanical force when they're landing up on the heel
Mm-hmm.
while
Yeah.
running, and that causes strain and ankle sprains.
Got
Mm.
it.
So this is very important for them to strengthen their lower body, major muscles of the leg, and also train in endurance. Endurance, it's like this simply. If they are using a weight of 5 kg and lifting their, or extending their leg, it focuses on the quadriceps strengthening.
Mm-hmm.
Hmm. But if they lift and hold for a certain duration of time,
Mm-hmm.
improves endurance.
Got it.
Only lifting improves strength. Lifting and holding that tension in the muscle improves endurance. So these are very minute factors that are very important in training, which I believe are ignored.
Understood.
Yes.
So in running, I've been running a long time myself, and runners. I think all runners at some point do, unfortunately, encounter injuries.
Yes.
So some of the common injuries, at least in my own experience, plantar fasciitis,
Yes.
runner's knee, etc.
Yes.
Um, Now, amongst all the patients that you see, what are the common ailments that runners come in with, and what do you suggest to them?
So basically, most commonly is the plantar fasciitis itself
Uh-huh.
because of the heel strike pattern on the ground
Yeah.
and the ankle sprains. So basically, again, we have to analyze what type of training they had gone through before running, or second thing is we have to analyze how they run.
Mm-hmm.
Basically, uh, if they have to run, the impact should be on the heel first.
Mm-hmm.
Okay, and then the landing of the foot should be straight.
Okay.
Just in case if there are any deviations in the ankle while running, then that creates a problem.
Mm-hmm.
So for runners, they have to analyze this. And second thing I believe strongly is the shoes.
Okay.
If they are using a worn out shoes, then that creates a problem, because if they're landing on their heel, the absorption capacity of the shoes will be very less, and that bombards his leg during
Mm-hmm.
impact.
Yeah.
So it keeps on, the leg keeps on beating on the ground because of the lack of proper shoe.
Mm-hmm.
So even uneven surfaces of the shoe itself will creates a problem,
Okay.
because if it is uneven, they are not landing properly. Either the ankle lands inside or the outside. So
Mm-hmm.
again, that causes uneven strain of the calf and the front side of the leg muscles and heel problems, and even the knee pains and the hip pains,
Mm-hmm.
because of the uneven transmission of forces towards the leg. So they have to be careful at one, proper training of their leg muscles. Second thing is use the shoes which are properly, either use a new shoes shoes which are worn out, they should not be using for running. They are not
Mhm.
eligible to use it. So you have to take care of this very minuscule factors while preparing for the training or while actually going for a marathon.
Okay.
Yeah.
Uh, Dr. Pratap, welcome. You obviously had something more important to do, so
I,
thank you
w-
for
I,
joining.
I won't say more important, just, life of a parent of two toddlers.
That's still, you're right, toddlers are more important than this session. No, but thank you for joining. We kind of volunteered Venkat to get started, so
Very nice.
we got the session started on time. Venkat,
Very
thank you
nice.
for helping.
Thank you.
Those of you who are on the call, I'm pleased to welcome, introduce Dr. Prathap Addageethala. He is, you know, he's a I'll say he's a friend of mine. I met him first many years ago. I can't even remember how many years ago, maybe 8 or 10 years ago. He was intriguing because he grew up in Canada and essentially trained as a chiropractor. And he decided that I'm going to move to India because India was still sort of nascent, uh, early days with chiropractic. So Dr. Pratap came in, and in some sense, I think he is a pioneer in this field in India. So uh, thank you for joining. Dr. Pratap, we just got started with some questions on exactly where chiropractic fits in the spectrum. There's physiotherapy, there's orthopedic. Where does chiropractic fit in? So why don't you tell us your own journey? How did you sort of pick this as a field of practice for yourself?
Sure. So just once, thank you guys for being here. I respect all of the athletes in attendance, and I apologize for wasting a bit of your time. I'm glad Venkat was able to cover up a little bit, but thank you so much for a wonderful introduction, Anand. Again, I'm Dr. Pratap. Welcome to our session. So to kind of really put a nutshell, long story into a very small story. Yes, as Anand said, I was trained and educated in Canada, born in Canada, and I decided to come to India based on the fact that there was only a handful of chiropractors here. Getting into chiropractic itself was kind of a story because it wasn't my first choice. It wasn't something that I had decided to do from the get-go. It's just something that kind of, the wills of life kind of pull you towards that those end goals. And I'm super happy where I've ended up and what we've decided to do with the profession here in India. So as Anand says, I do feel like a bit of a pioneer. Aside from we have the unfortunate burden of both being healthcare practitioners and entrepreneurs, but I'm happy to represent both. You know, so we are one of the largest chiropractic clinics in India, if not the biggest. We have the most number of chiropractors working for us, and the main thing about what we do is that we are patient-centric and results-driven practice. So it's not about what we want; it's about what we can do for you guys, the patients. And this doesn't necessarily have to relate to an illness, some sort of an injury, some sort of damage. It can also just relate to maintenance. As Venkat, I just heard him at the tail end of that talking about shoes and making sure that your shoes are in good shape. Well, it's also important to maintain your spine because you only get one. Your shoes you can change out anytime, right? You can change every 3 months if you have to, but your spine you only get one crack at it. Sorry for the pun. So that being said, it is a situation where like I feel like an intrinsic part of the healthcare community when it comes to just basic health. We're non-allopathic, so we don't prescribe medicine. We don't suggest surgery. Of course, if a situation passes along and there's no other way to do it, you have to do surgery. Then yes, of course, we're going to recommend surgery. But holistic care, maintenance, prevention-based care is what chiropractic's all about, and that's really where it fits into the grand scheme of things. You have orthos who prescribe medicines and surgeries, and you have physios who help with the damage component of it. But what happens in between? What happens? You have a perfectly working body, and you want to maintain that. What do you do then? And that's a really strong niche that chiropractors occupy.
Sure. So it sounds like I come to you and you examine me. Venkat was saying it's a very customized examination. So each person is different. So
Absolutely.
after you examine me, then you're going to help me, after that examination, give me a set of exercises, give me some tips on how I can maintain my body and basically become a better runner. Is that correct? So then I can go home and continue on this program on my own.
I just had a lady come in, and she was the wife of a person who was coming to see me, and she was just talking about Malnad, and she wanted to join this round, but
Mm-hmm.
based on whatever health issues she'd had, she's going to have to push to the next year.
Mm-hmm.
And she was asking the exact same questions, you know, do I come to you just cause, or, and she's worked really hard to get to where she is. She's doing full marathons. She's doing all those things. And she'd lost a bunch of weight. And she's like, I don't want to go backwards. I'm already the fastest in my women's group, you know, blah, blah, blah. And she has all these accolades, and she's like, I don't want to go backwards. And I'm like, this is for you. This is
Mm-hmm.
absolutely for you. So whether you're starting out at the beginning of the spectrum or you're at the end of the spectrum where you're a seasoned athlete, these corrections and these maintenance adjustments can really help you. Of course, you could be carrying something that you don't even know about, right?
Mm-hmm.
There could be misalignment. You can look at the wear and tear of your shoes, right? If you
Mm-hmm.
see that one side of your heel is wearing a little thinner than the other, there's a possibility that you have a pelvic imbalance, or there's a rotation. There's something mechanically that's slightly off. And that may or may not result in pain or discomfort or performance decrease, right?
Yeah.
So it's a good idea to get examined in a nutshell.
Sounds good. So, Venkat was telling us, it's important to sort of pay attention to all the big muscles in the legs, the glutes, and now you're talking about the spine.
Absolutely.
So, for an overall health, or for overall fitness, especially for running, what are the other body parts, if I may use a generic term, that I should take care of?
So it starts and ends with the spine. So we talked about that. We talked about the pelvis. The pelvis is
Uh-huh.
another big one because that's your axis of motion. Well, while your legs are in motion, right? The axis comes from your SI joints, or your sacroiliac joints. So that's part of your pelvis and your sacrum, and it all feeds back to your spine. So a lot of back pain starts and ends with sacrum and ilium.
Uh-huh.
I I have a few things that we want to talk about in terms of like major injuries, but there's a song, there's a really old song, and it goes, the neck bone's connected to the backbone's connected to the leg bone, etc. So, and that's
Yeah.
literally what it is, because it's one big system. And that
Yeah.
system, if we're not connecting it correctly, we're not maintaining it correctly, can really go awry. So the big ones that we've highlighted for you guys today, starting from the back, I'm going to be talking to you guys a little bit about discs. Discs are the soft tissue that are in between each of the vertebrae in the spine. Um, we are going to talk to you about the IT band and the TFL. Those are two big kind of runners muscles, because you guys have all heard of runner's knee. That's something that affects a lot of runners, especially long distance athletes. We're going to be talking about shin splints, which is something that runners often get as well. We're also going to be talking about the dreaded plantar fasciitis. So those are all key things. And like, as I said, we went from the middle of the spine all the way down to the foot. So we are looking at kind of the lower extremity. We are kind of looking at the lower kinetic chain. But as you guys run and run and run, posture becomes an issue. We want to maintain neck integrity, because there's a lot of, bounce, 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 a lot of compression on discs. We want to make sure that your flexibility and mobility throughout your entire spine is good, so you don't accrue pressure at any one given spot. But for the focus of our conversation today, we're going to be focusing on back, thighs, and your calf muscles, as followed by your plantar fascia.
Okay. So plantar is easily the most common running injury, at least in my
Well,
circle.
you'd be
Yeah.
surprised, because
Yeah.
runners internationally, the highest percentage of runners have issues with hip flexors and IT band syndrome, so pain running down the side of their leg.
Okay. So it's going to be difficult on a video call, but why don't you quickly give us some tips on how to manage plantar fasciitis and
Let me open a little
IT band? Yeah.
presentation that I have for you
Ah,
guys. Let me
okay.
see if I can
Nice.
do that. Just a second. Mm, just give me a quick second here.
I hope you have screen sharing rights. I believe you do. So.
Let's see. Should be here somewhere. Just a sec, guys.
Okay. While we wait for the presentation, for those of you who are on the call and you have a question, please, feel free to type that in the chat window, and I will moderate it towards the end.
I actually don't have access to screen sharing. It says I'm not allowed to.
Okay, 1 second. I'm sorry.
That's okay.
Okay, you want to try now?
Oh, perfect. And we're going to be talking about shin splints here. Or are we talking about IT band?
Field is yours.
Okay.
Whatever you see commonly.
All right, let's.
Are you able to screen share now?
Yes.
Okay.
Okay, I think we're going to start with the IT band syndrome, because that's the highest up. I'll talk about discs at the end. And I'm going to switch it over back to Venkat to kind of present his, because this is his show. This is something that he's put together for us. So I'll let him kind of walk through this with you guys. So we'll start with IT band syndrome. I'll pop this up, presentation view. There we go. And oh, let's see.
You're still unable to?
Just a sec. Here we go. All right. Venkat, just tell me when you want me to move the slide, okay, Venkat?
Yes, Doc.
Dr. Prathap, you might want to consider going into a presentation mode, so you'll get a full screen.
Okay. There we are. Can you see that screen?
Yeah.
Okay. Venkat, it's all yours.
All yours, yeah.
Yeah. So next slide, Doc. Yeah.
I've changed the slide. Can you guys see that?
Not changing here. So
Yeah, it's not changing.
Oh, interesting. Can you see this? Can you see the presentation?
Yeah,
okay.
It changed now.
Okay, fine. See that? It says, what is iliotibial band? Is that what it says?
Yes.
Okay, perfect. All right, let's go.
So basically, as Doc was saying, obviously it's common for most of the runners to have this IT band tightness. Again, it's a result of lack of, most of the people are not aware of this, that they don't get the proper examination of their muscles, and they don't know that they have IT band tightness before running. So usually this IT band during the running, it gives proper stability, while running, while standing. All those dynamic activities would be supported by the IT band muscle. Especially when for running, people who are marathon runners, they go with this repeated knee extensions, knee straightening and bending movements during the heel strike pattern or during the running pattern. This is the where if the IT band is not flexible enough, it gives a strong impact to the knee and hip muscle, which ends up in strain.
I just want to jump in here and mention that if you guys can see my cursor, this muscle here, this orange muscle, yes, that is called your TFL. That is your tensor fascia lata, and the IT band is often considered an extension or a tendon sheath that derives off of the tensor fascia lata or TFL. So whenever we have tightness along this sheath, which runs down the side of your leg and inserts into the outside of the knee, the TFL is often indicated. So, I mean, a lot of the times we'll get into treatment at the end, but this is kind of a region that we cannot ignore if you are having side of the leg pain and side of the knee pain. Yes. I'll change the slide.
Yeah. No.
Has it changed?
Not yet.
Oh,
looks like there's a delay for some reason.
Yeah.
It's changed now.
Okay.
So what exactly is this IT band syndrome? Usually it's a non-traumatic injury. It mainly caused by repetitive movements. In case of runners, where they go with repeated knee straightening and bending movements, it's kind of overuse, repetitive injury that causes pain, swelling around the outside of the knee, and sign of redness and everything. So this pain cannot be ignored like the outside. So that's why it's commonly mostly called as runner's knee, because we commonly see them in runners, and also some of the cyclists who goes long marathon cyclists, and some golf players and football runners. So that's the IT band. Usually, it's a non-traumatic injury. So the common symptoms people encounter during this IT band syndrome is hip pain. So again, hip pain, knee pain, pain over the outside of the knee, which is called as a lateral epicondyle, that causes inflammation and pain, and warmness, redness. Sometimes, if we palpate the area there, we essentially feel the rubbing sensation over the knee. That's what we call as crepitus.
You can also hear it as like a popping sound, a
Yeah.
clicking sound. Crepitus is just joint motion.
Yes.
Crepitus can happen in any joint, really. The warning sign is where the clicking of the joint actually causes pain. Where at the in like when you feel that cracking noise from the joint, you feel pain associated with that cracking. That's when it becomes a problem. But a moving joint can crack without having any discomfort, any major pathology. So that's not a factor as much as it is just a kind of like a an indication.
Yes. So if we do ask them when exactly are you feeling the pain, they would say the pain usually feels after starting the exercise, or during running, or while climbing stairs or descending stairs, or while running uphill or downhill. And usually the pain would increase if they performs these activities. That causes more pain, and they would stop doing those activities.
Great.
The next slide, Doc.
Yep.
So these are the common sports person who are affected. Usually long distance, usually the marathon runners, the marathon cyclists, or occasional cyclists, soccer players, basketball players, who performs these repetitive activities of knee movements, straightening and bending movements. Uh, so obviously, head causes because of this overstrain. Oh, so these are the most essential factors I was earlier speaking about, that the training errors usually. No proper lack of exercise. If they're not exercising, there's no proper frequency or intensity of the exercise that they're performing. Second thing is the anatomical factors. I mean, if they are having any tightness of the muscle, or any leg length discrepancies, that causes the Eddie band syndrome. Next slide, Doc. So the training errors will be like the exercise itself starts with the warm up phase. So in the warm up phase, if they are stretching, but it is ineffective, then it doesn't the exercise itself is not ineffective. Ineffective, I mean that if they are stretching their IT band, they have to stretch and hold at least for 30 seconds, and at least 3 to 4 repetitions of intensity. If they're not doing this, then that won't be effective. Then that does not give enough fitness for that muscle in the flexibility range. So that tightness won't go, and it creates an impact during running. Second thing is pushing too hard. uh, no proper lack of training to that runner, and then he abruptly starts running suddenly for the marathon in an excitement, that is not no good thing to start with. And no proper rest between the workouts. And then like I said, wearing worn out running shoes, and also running downhill slippery surfaces or uneven surfaces where your ankle twists to side, so it goes into a wrong impact. Usually the heel strike pattern would be the right impact during running, but in case of slippery surfaces, the foot strikes the ground abnormally. That causes pain. Then yeah, next thing is anatomical factors, doc. The next slide. Yes. So again, like I said, the body factors itself, where IT band is too tight and they're not working on it, or if a person has an at least starting stage of knee arthritis, or no, the Q angle is where the hip to knee angle should be at least 15 degrees to be normal. If they have more no Q angle or very less Q angle, that would affect the running pattern of movement. uh, and also high arches and no restricted range of movement. Again, the range of movement itself defines their flexibility of the muscles of the no foot or the knee or the hip. Again, the main important part is the hip abductor weakness, that is the gluteus medius weakness. Usually there is certain criteria, like they have to be eligible to perform certain amount of repetitions of glute bridges, usually not the double leg but the single leg. During the single leg glute bridge, if their pelvis is twisting to one side, then it is a compensatory movement. So that signifies or that determines the weakness of the glute side glute muscles. Then again, that creates impact on the IT band. Yes. Any questions so far? Any doubts?
I just wanted to quickly jump in here as well and say that, you
Yes.
know what, we're talking to an educated crowd, right? We're talking
Yes.
to a bunch of people who have a lot of experience with running, and I
Yes.
mean, for the most part, I know myself and Anand have talked about this before, and there are some people out there who are still new to running, and they're testing their limits with the Malnad Ultra, but these are things that definitely you should always go in to see a physiotherapist to understand a little bit better. I mean, you can go on YouTube and figure it out on your own, but there's nothing like another pair of eyes to help you with diagnosing it. And early diagnosis is the key to prevention. So if there's anything that can be done to strengthen and improve, for example, Q angles or increased compression at the medial knee, those are things that we could really help with in terms of physiotherapy. And that's kind of a segue into our next section, which is what do we do? How do we diagnose this? But yes, sorry, if there are any questions, this is a good break. If not, we'll continue.
Okay. Then how do we diagnose the IT band? Usually through physiotherapy point of view. Usually first thing is we do examine where the IT band is, also the surrounding muscles of the leg. Uh, we do the movement, usually the knee straightening and bending movement, and palpate the outside of the knee to check if there is a crepitus, or if there is a popping sound heard of. Again, we put on palpation, like on a pressure, we put a firm pressure of where IT band is and check if no there is a no palpable or felt crepitus sound. The second thing is a Rene. We call it as a Rene test, or we one more thing is a Noble test. So Rene test is where we ask the persons to stand on a single leg, maintain a single leg stance, and just squat. If at all is feeling any kind of sharp pain over the no lateral knee or outside of the knee, then that determines the positive of the test that he has a Haiti band syndrome. Second, next thing is a Noble test. So it's called a Noble compression test. We do no compress at the outside of the knee with a firm pressure, and just straighten the knee while doing it. And the pressure itself and the movement itself causes a sharp pain or discomfort to the patient, and that determines the positivity of the test, and we do diagnose it as a IT band syndrome. Usually it comes whenever knee is bent to at least a 30-degree range. And then yeah, that determines the positivity, along with the examination and palpation. Yes. And then we'll determine the cause why the person has an IT band syndrome, because with examination of other muscles, IT band itself. So we classify IT band tightness, gluteus medius weakness, and all that, the contributing factors. And other diagnostics tests we can rule out apart from physiotherapy is just for the confirmation of IT band syndrome is MRI. We prescribe MRI and ultrasound, but more of MRI, which confirms the diagnosis. So the treatment part is where the first line of defense we give them is stretches, usually the IT band stretches. So the steps wise IT band stretching is very much important, where the person should also have a proper balance during while performing this test stretch. So he needs to cross over his knee, the side which is stretching the IT band. The leg should be, at the behind of the other leg, and then he should slightly bend his trunk to the opposite side with arms raised, and then he'll feel the stretch from the hip to the outside of the knee, all over the side, and that stretch to be maintained for at least 30 seconds, and at least 3 to 4 repetitions would be considerable. Yes.
Venkat, I'll interrupt you for a second. We had a question from Ashwini. Yeah, so Ashwini wants to know about, you talked about heel striking a couple
Yes.
of times. Now that's a topic that divides runners right in the middle. So there are 4-foot strikers and heel strikers. So I think I know what Ashwini prefers. So uh, what about, what is your take on 4-foot striking? Is that completely
So
something we should not be
basically,
doing?
basically the pattern of heel strike comes from the foot and the hip itself. Usually, when we even walk, uh, the heel strike pattern or the foot swing pattern, it usually we place the foot usually in the neutral side. I mean, the leg should not deviate so much outside, or the leg should not deviate so much inside while walking or while running. It should exactly fall straight. If in case there are any deviations in this heel strike pattern, I mean the foot, the exactly heel of the foot should strike the ground in a lifting pattern, where the ankle is in the air, only heel strikes the ground in a neutral or a straight pattern. If it strikes abnormally with a ankle twisting little inside or the outside, then it causes uneven strain on the muscles and even the IT band, and causes so much pain. So how to determine that? Usually again, consult a physio. You have to consult a physiotherapist, and we have to examine your gait pattern, the walking pattern. We analyze that in a slow motion and see if you're properly, if you have a normal heel strike pattern or not. Again, that can also be examined in running or too. Uh, so that's how it is determined.
Understood.
So and,
So,
and 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 basically from the research, it just basically shows that if you're a heel striker and you prefer running with heel strike and you have no injuries, then it's perfectly fine to continue running that way. But the requirement for maintenance would probably be more than if you
Yeah.
were a neutral or a 4-foot striker. There are also pieces of research that show that 4-foot runners will and 4-foot runners for distance tend to get injured more frequently than heel strike runners.
sure. So, Venkat, I know you're coming out to the Malnad Ultra. So I know Ashwini uh,
Yeah.
and me, we will certainly corner you on this one. So
Yeah,
some
sure.
long conversations with you. Let's move on. Thank you.
Yes.
So next thing is a foam roller exercise. Again, the side of the IT band where which is affected should be placed on a roller and then just keep on rolling back and forth to release the tightness of the IT band. But this is, I believe, the secondary to the main stretches which we are doing. And also, I think I didn't mention here, but apart from the stretches, they have to go through strength training too, to strengthen the IT band and the surrounding gluteus medius, the side glutes muscles. And posture is definitely very, very much important, because even poor posture during running or during walking or even in a static posture, just in a standing, it plays a major role, no, in sports.
All right. Thank you, Venkat. I know you have a take-home message, but we're going to skip through that.
Okay.
We're a little behind. I know you guys had scheduled initially for just 45 minutes, and I apologize for taking 20 of those. So if anybody needs to leave, I completely understand. We have a few more topics that we'd like to cover. I'll try to run through them a little bit at a quicker pace so that we can at least touch on each of them. Does anybody have any questions at this point?
Think there is one question from Shailesh Shaurya.
Yes, I see that. IT band is okay. So IT band is considered a tendon sheath. It's not actually considered a muscle. The muscle is the belly of the muscle basically lives in the TFL, as we had mentioned before. That orange. Oh, let me see if I can pull that back up. I'm sorry, I think I closed it. Yeah, so it's that orange band at the front. It's kind of like the front pocket. If you can think of where your front pocket would sit, that's where that muscle is. And it is an extension of a tendon. So tendon is basically where the muscle inserts into a bone. Okay, this one is weird because it's called a tendon sheath. Let me see if I can share this now. 1 second, guys. The tendon sheath is kind of an elongated tendon. And okay, here we go. Can you guys see that? Yes, no? It should look like just a guy. All right, so this area here, this little pocket muscle in the front here, that's your TFL. And this tendon sheath runs all the way into the insertion points of the bone. So to answer your question, the best way to strengthen your IT band, it can't be strengthened on its own, is to strengthen the muscles that pull on the IT band, specifically your hip flexor group and your adductor muscles. Sorry, your adductor muscles. I hope that's okay. Hope that answers your question.
Sure. Dr. Pratap, time check. It's just 12:50, so maybe you move on to the next topic.
Yep, absolutely. We got it.
Thanks.
So I'm going to just quickly talk to you guys about the spine, because that's my forte. Let's see if we can open this up properly. Okay, good. So I'm going to just take it to a website because that's the easiest. Here we go. Perfect. Okay, so I'm going to walk you guys through a basic MRI. What we have here is the brain, okay? And this black tube coming down that I'm following with my cursor, that is the spinal cord, okay? The squares here, these are the bones in the spine. And these fish-like gaps, those are the discs in the spine, okay? So as we proceed all the way down, this is the lumbar spine, and this is the area that I would find are the most problematic for runners. So the squares, again, bones, these kind of gap spaces, those are the discs. And this white fluid here, that's where the spinal cord lives. The spinal cord finishes off around here and continues down as a bunch of nerves. You guys can see here that the disc kind of maintains its shape. It stays flat towards the back edge of the bone. Okay, so this disc would be considered normal. This disc would be considered normal. But this disc down here would be considered protruded out. Now, there's different classifications. I'm sure you guys have heard of a slipped disc before. That's kind of the more lay description for it. You might also hear of it in terms of a herniation or a prolapse or other things like that. those are the areas of concern when we talk about running. So the compression that happens between this bone and this bone will continue to allow this disc to further deviate out. So any compression in this area which touches a nerve can send signals down your leg called, which other people may call sciatica. Sciatica is not a diagnosis. A lot of people come and say, I have sciatica. And I agree with them. They might have sciatica. Sciatica refers to a pain, a burning, a tingling, a numbness sensation that runs down the back of the leg. But that does not necessarily mean that that's their diagnosis. Sciatica comes from somewhere. And most often, it's not coming from the piriformis. Most often, it's coming from a disc bulge pressing on a nerve down here. So that's why it's always important to listen to your body and go into consult an expert as soon as possible, even if you have the slightest doubt about discs and nerves. I'll stop sharing that for a moment. So when it comes to running and discs, I typically tend to ask people to back off of their running if they are experiencing a disc bulge, because the amount of compression that occurs as you continue to stride forward increases and increases, especially for long distance runners. Now, this is not a doom and gloom type of situation where like, okay, you're finished once you have a disc bulge. It's not like that. And a majority of disc bulges do not need surgery to correct. A lot of the time, it is just a matter of mobility, movement, and functionality, which can be done through a chiropractor, physiotherapist, or a physio-chiro team, like in our case. I would like to continue along. I mean, that was just the long and short of discs and the spine. Does anybody have any questions about that? It's a fairly simple idea. It's a fairly simple recommendation. But if there's anything else that would like to be discussed upon with that, I'm happy to answer any questions related to spine, disc, running.
So, Dr. Pratap, is just about stretching the back. I mean, what do you recommend to maintain the disc?
So stretching is important. Stretching is like exceedingly important. I think that if anybody does not do a stretching routine after their runs, they're really putting themselves after it. And this is kind of this kind of touches on what our cardiovascular thoracic surgeon was saying last Sunday, and that is getting out of your chair is super important. The mileage that we put on the road, it pales in comparison to the mileage we put on our spine while we sit all day. So as the doctor was saying, sitting is the new smoking, but the reason that that is the case is because we're learning a lot more about the negative effects of sitting for our spinal health now. Previously, doctors used to prescribe smoking for breathing problems. You know, that was the case back in the day. But now we know more. We know that smoking causes cancer. People still smoke, but they choose to. It's not one of those things that they don't know the risks. When we're sitting, as our lifestyles became more and more automated and IT related, we didn't know how much effort was going to go onto our spine, how much pressure was going to go onto our spine. And now we're learning the ill effects of how sitting can affect us negatively. So two real important stats to think of. If you work out for 1 hour a day, that's 60 minutes, but you sit for 8+ hours a day, it renders your workout 70% null and void. So it's like you've only worked out for 18 minutes. Second of all, if you sit for 8+ hours, it increases your chance for cardiovascular disease by 90+%. So key is get off your butt. That's it. So runners don't really need that impetus to get up and move around, but it's just one of those things like, yeah, I'm running. I ran a half marathon the other day. I'm fine. I don't need to stretch. Incorrect. And I don't need to stretch on the days that I'm not running. Incorrect. You do still need to run. You still need to stretch post your runs. It's absolutely important. I would recommend a stretching routine for a daily type of thing. Hip flexors run from spine to thigh. How sitting long hours and postures? Yeah. So absolutely. So this is Shailesh has asked another good question about hip flexors. They run from the spine to the thigh. So specifically, what you're talking about when you're talking about the hip flexors that run to the spine, we're talking about the psoas muscle. The psoas muscle is also known as the muscle of the soul. That muscle is actually indicated in a lot of back pain. It's artificial back pain because the hip flexor actually Like we think of the spine as a flat piece, but in fact it's actually like a pipe. So it does have a front surface and a back surface. So when the psoas muscle attaches to the front of the spine, it runs through the hip flexor, through the groin, and attaches outside of the hip. So if that is the case, if that muscle is indicated, then yes, it does need to be released specifically. And of course, sitting long hours increases the compression on that muscle. So if you're contracted while you're sitting, your knee is bent, your hip flexors are being contracted the entire time you're sitting, that's the reason why they get injured. That's the reason we add mileage to those muscles, and they require separate treatment to release. That's the reason why they cause injuries. All right. So I have another presentation today about the plantar fascia. So I'm going to jump onto that right now. And I'm going to do the presentation for it. This was done by another one of our team members who you'll be meeting in the Malnad Ultra. I'm going to be running through this very quickly. And again, we're kind of out of time already. Sorry for this, guys. But we can call it a day. We can end the presentation at that point if required, but if there are people who do have a little bit extra time, I do have more stuff to present, so it's up to you guys.
Sure, let's run through this quickly because it is a very common injury situation.
Absolutely. Okay, can everybody see this?
Yep.
Okay, so the plantar fascia is a thick piece of connective tissue which supports the arch on the bottom of the foot. It runs from the tuberosity of the calcaneus forward, so the calcaneus is your heel, and to the heads of the metatarsal bones. The metatarsal bones are the large bones that operate your toes. The plantar fascia contributes to the support of the arch, and it has an important role in the function of our gait. The plantar fascia is the tissue. Plantar fasciitis is the injury. So it's inflammation of the plantar fascia. And it usually occurs at the insertion of the plantar fascia on the heel, on the calcaneus, on the underside. So what you can typically feel with this is pain, swelling, warmth, or even redness. You can feel pain into the arch, and people who have flat feet are also at risk for, or who are overpronators, are at risk for developing plantar fascia more. Obviously, like obesity, extra pressure on the plantar fascia, long distance running, ding, and of course the tight Achilles tendon. Tight Achilles tendon is something that I harp on all the time, and that's something that we'll talk about again. Shoes, Venkat has beaten that to a pulp. So shoes with poor arch support or soft soles are usually not recommended for people who are prone to plantar fasciitis. What do we usually use for plantar fasciitis? Obviously, the basic physiotherapy, electrotherapies, manual therapies with hands-on stretching, taping, orthotic devices, as well as trigger point therapy. So this combines into something related to ankle mobility, but I wanted to add a little bit more to the plantar fasciitis discussion. So you guys are familiar with the calf muscle. The calf muscle, I'm going to see if I can get another image for this, but the calf muscle kind of sits up here. If you can imagine your leg extending up here. So the calf muscle sits up here, and the calf muscle thickens. We're going to go back into this tendon discussion. So there's a muscle belly where the gastrocnemius, or the calf muscle, sits up here, and it thickens and thickens and thickens and thickens into something called the Achilles tendon, which you guys are probably familiar with as well. The Achilles tendon inserts into the back of the heel right here, okay? And then it continues along as the plantar fascia. So in fact, what we have is one continuous piece of tissue from the calf muscle all the way down to the toe. So if the tightness in the calf muscle is not resolved, our plantar fasciitis doesn't have a chance to get resolved. Okay, so resolving calf tightness, whether you're stretching every day, you're doing releases, you got the hypervolt, or you got the massage gun on it, you're doing foam rolling, you're doing the you're doing hot cold therapy, you're doing compression, whatever it is, however you can start to manage that calf muscle on a day-to-day basis is the beginning of reducing plantar fasciitis. Now, you guys, let me see. Okay, yeah, so there are some stretches here. So ankle mobility is another key component of plantar fasciitis. So anytime we have a reduction in flexibility of the ankle joint, you risk the surrounding area for weakness, pain, inflammation. So when your ankles are flexible, you have greater range of motion during your activities, which is pretty key. And ankle mobility helps in absorbing shock. So if you have flexibility, it's about your soft tissue, and mobility is about your joints range of motion and your ability to function properly. So it's not okay to just be like, oh, I'm super flexible. You also need to have mobility. Mobility also means range of motion under control. You should be able to control that range of motion as desired. If you just have like a ton of flexibility but no control over it, you're also at risk for injury. So a quick test for ankle mobility, and this is one you probably see on Instagram and YouTube all the time. So you stand barefoot with your toes a couple inches from the wall, keep your heel planted on the ground and lean forward so your knee approaches the wall. The goal is to touch the wall with your heel while your heel is on the floor. So you want to touch the wall with your knee. If you're able to do that with your heel planted, you have pretty good ankle mobility, and running is okay. So I know all of you guys are going to try this out later on. And Anand, what I'll do is for all of the home remedy stuff that we either get into or not, I'll send a short little thing out that you can distribute to everybody who's present. So they have a little package from us. Mm-hmm. And of course, when we're talking about plantar fascia, I always talk about calf muscle. So a couple of calf stretches here, ankle circles, ankle stretches at the wall, on an incline, walking lunges, and of course, rolling out the foot. Now, what I recommend for rolling out the foot is to freeze a plastic water bottle. If you stick a plastic water bottle in the freezer, put a sock on, you can sit, watch TV, and also manage your plantar fasciitis by rolling it. What I would recommend is rolling all the way from the heel to the toe, all the way through the arch and to the opposite side of the foot. So don't leave any space unpressured by the frozen water bottle. That's one of the most effective things you can do. Other things you can do for arch improvement is to grasp things with your toes, like a piece of paper, a tea towel, something like that, just to help to engage that arch and to build strength through it. Strength is one of the easiest ways to defeat weakness, obviously, and weakness is often part of the process in plantar fasciitis. So building strength through the arch is another way to defeat it. That's that. Quick and sweet.
Thank you. Dr. Prathap, I think we should, close the session now. Yeah, call it a day. It's, past 1 o'clock. So thank you for joining us. It was a little bit of a technical session. Some of it did go over my head. But, just to pull in good humor, right? So what you said is don't run up and down hills, don't run on trails, and that's exactly what the Malnad Ultra is all about. So
don't run at all. Think of something else.
We're all good. Yeah. Thank you for your time. If anybody has any questions, feel free to send that along to us, and we will reach out to Dr. Prathap and his team and get you the answers that you want. Okay.
We'll be there at the Malnad Ultra. We're excited to see you guys and support you guys on your journey. Thank you so much for your attention. I really appreciate it. I apologize for the late start. Again, as Anand said, please send us any questions you might have, and we're available to answer whatever you need from us.
Super. Thank you all. Enjoy the rest of your Sunday.
Have a great Sunday. Bye, guys.
Bye-bye.